because they did not use, not see some silages are falling, which is, it will continue like this without using it.
We have equipment provided by the people that built this place, but there is no drug.
Majorly in that place, we need manpower.
It will be a waste of resources if we just erect these structures and we don't have them properly equipped and with the appropriate manpower manning this.
In the year 2000, 189 countries agreed to a vision that would ignite genuine change in the development stories of the world. That agreement reads in part, and I quote, "A world where people are less poor, somewhere where anyone can get a good education and health care, a planet and a people which has a sustainable future." End of quote. That is the script most national local governments and even major industrialists across the globe have been trying to act out without much success. In most rural communities around the world, healthcare services and access to them remain major challenges. People in those areas face some different health issues than people who live in towns and big cities. Oftentimes, it is difficult getting a hospital quickly in an emergency. People also have to travel long distances to get routine checkups and screenings. The situation is even made worse by the availability of fewer doctors and dentists and certain specialists. Across the length and breadth of Nigeria, the healthcare infrastructure in much of rural settlements is a web of small hospitals, clinics, and nursing homes, often attached to the hospitals. It is the general belief that any reform must be targeted at providing these facilities with resources to update their technology, provide healthcare to the unreserved and underserved. In this regard, the Association of Local Governments of Nigeria, ALGON, a few years ago, took very bold steps to address the poor healthcare service delivery in rural communities. ALGON had constructed and equipped a sizable number of health centers for communities in the 774 local government areas nationwide as part of its corporate social responsibilities. ALGON achieved that feat in collaboration with Mathan Nigeria Limited. Years later, sustainability of the projects has become an issue with most of the healthcare centers either abandoned or the facilities now decayed owing to non-usage.
People that they have the project, they say they have completed, they have given us a handover letter. And I submitted it to the area council that, okay, this will say they have finished their project, they have give us equipment. So it's left for the area council now to come and commission the place, they should use it. And for long now, they have been shifting, giving date up to now. They didn't come and open the place to put the staff in use. Otherwise, we are here even with the chief in this place. When this place, we are the one that cleared this. If you see this village, this bush, you cannot see even this roof here. So we clear it, thinking that they will come and open. Even the community, they are disturbing. When are they going to open this? When are they going to? And they have said tomorrow, up to date.
They have built it for the community and for the local government. But all this while, we have raised alarm, said hence this amenity is here, and our people do suffer from all these health problems, and that is why it is being built. But yet, I don't know the kind of politics that are playing inside it, so I can't just tell what is happening.
We have no staff, enough for staff. There's no doctor inside the hospital. That is why the hospital is not open. Secondary, since they finished that place, the contractor hands over to the local government chairman. Since then, they are not take action. So our people are suffering to go to near hospital. Let's say in Gwagwalada, there's another one, he called Aliheri. That one is private hospital, not government owned. So I pray and I appeal to the government to open that new hospital for us. So that's how people are suffering.
Because they did not use, now see some ceilings are falling, which is, it will continue like this without using it. But at even we are using it, it should not be like this. So I don't know what you people will say to area council. Because some places know that they officially commission. They will just come and call the chief of the community with people they gather, say, okay, this clinic it has been ready for use now, and the staff will work there. You need their cooperation. So I will start work. Simple. But the politicians, they were waiting when they will have money to come officially spend to do some ceremony, which will not take.
As the third tier of government in Nigeria, the local council is responsible for various services, which include administration of health centers, basic environment sanitation, and other aspects of preventive health services. The snag, however, is that local governments in Nigeria are currently in a period of financial stagnation and so unwilling or unable to maintain old projects or even start new ones. This, therefore, means that existing and functional projects like the comprehensive health centers are left to rot away. Implied too, host communities are now left with the option of using their limited resources to attempt to manage the healthcare centers. This trend has not been self-sustaining, as evident in some of the health centers visited in communities in Anambra, Imo, and Nasarawa states, as well as the Federal Capital Territory.
Majorly in that place, we need manpower. There are not enough staff because shortage of staff. And also, there is no electricity in the place. There is no electricity in the place. Our mega that are there, they are not being paid. They are doing, what do you call it now? Voluntary service. Voluntary service. Most of the workers that are there, so they are voluntary. They are voluntary. There is not as if they are on the payroll. So these are the troubles that we have in the facility.
Well, the major problem of this facility is lack of staff. We need a doctor in this facility. We have shortage of staffs. That's what I think we need in the facility. We need an access route from the Kefi roundabout to the facility. Especially during rainy season, the road is very poor.
So all those windows, we don't have protector, and you see the front of the estate of the hospital. You see, if you see the major door when you come in, if we see that the door is not that good, or the hammer. We don't have water here, no borehole here, no light here, and it has made us, none of us is able to live here. The road is too bad, and we all come from far places. Despite that, we have been coming to work, but the thing is that people are not responding. When we come here, we stay till 4 and we go.
What is very obvious from feelers gathered the communities visited is that they all have extremely committed members who will work for the general good of the community if they have the space to do so. As a major player in Nigeria's health sector, Mathan Nigeria Limited, which has been a highly respected provider of medical equipment and supplies, says beyond giving host communities ownership rights, there is an urgent need to adopt a more sustainable and result-oriented approach, especially in the running of rural health centers and facilities.
The hospitals have been built and are being built, those that are not yet completed. We equip them with modern medical facilities. We also intend to partner with drug manufacturing companies across the country. They will bring their drugs. In fact, there will be a synergy between the drug manufacturing companies and the pharmacies in these health centers, whereby the drugs will be brought, the pharmacists will dispense, and at the end of the month, or whatever arrangement is put in place, the pharmaceutical companies are paid for the drugs they have supplied. And in so doing, we have ensured that good quality drugs are brought, no fake drug to be administered to anybody, any patient. And we are sure this will also go a long way to improve the skills, the practical experiences, on-the-spot experiences of these pharmacies. And the doctors as well will not be left out, because as they are handling cases day in, day out, they are gaining more experiences, because these are mainly youth core doctors.
The benefits of having well-equipped healthcare centers in every local government is that it will help us in achieving the Sustainable Development Goals as outlined by the United Nations and the WHO. And this would also help to reduce the health burden on the population, considering that more than 60% of the Nigerian population are local or rural dwellers. Bringing healthcare closer to them would help us in reducing the under-5 mortality rate and reducing our maternal mortality rate, of which Nigeria ranks very high in all these health indices. This will also help to reduce the burden of healthcare provision that is now saddled with the tertiary institutions, where you see people coming to tertiary institutions to treat conditions like malaria, typhoid, measles, which ideally should be handled at the primary healthcare level.
The company says its proposal is to be entrusted with both the consultancy job and management of the rural health facilities. This move is further fueled by the current situation of rural health centers nationwide, which the management of Mathan Nigeria Limited insists is a disservice to the people. For instance, at the facilities in some communities in Amaduru, Osomogu, and Ihiala local councils in Anambra State, the story was not too palatable.
About 2 weeks ago, our state governor came to Ihiala and commissioned one of the giant water projects in Anambra State. And during the commissioning, he said that the water will cover numerous mileage, today called kilometers, which I am sure Osumogu is within the range. So it is only we look for the contractor. At least I know 1 or 2 people in my local government who knows the contractor. Why I'm saying that is because the job had been given before my office assumption. So I don't know everything very well, but I came to understand that day when governor was speaking, he said that this borehole is this, and we cover so many areas like this, which I'm sure Osumogu in Ebonyi zone is among the areas the water will cover. Then in another side, they said about burglary on the windows and doors to keep safe of certain things there. Well, I've heard it now. We will put up our bill to the state, telling them that the beautiful hospital you made for us, see our problems there. Yes, it's very, very good. We are commending you for it, but please help us for certain facilities like burglary to enable the resident doctor to live there.
The situation was not any better with the healthcare facilities in some rural communities in Imbaitoli, Ehime, Mbano, and Ihete local government areas of Imo State.
We have equipment provided by the people that built this place, but there is no drug. Government has not given us any drug, except the one rolled back malaria pepper, just few malaria drugs they brought last week here. Since then, we have not been given any drug.
Well, the government they come into my community. We gave them land to build it, but what stops? And they have finished it. So what is holding them? We can't employ the doctors and the nurses to pay them. Are we? Does the community do for that?
Free treatment. Chief Atan give free to Umeze people. That's the only doctor I saw here. That's the only day I saw some doctors here.
Where?
It is the 22nd November, if I'm not mistaken. It's only once, even though I make mistake of the date, 2015.
A trip across the Niger to Kefi local government area of Nasarawa State also exposed the rather poor states of facilities provided by Algon.
For example, now, even of the day before yesterday, my driver, the son, the wife to the son give birth around 2 midnight, and they can't use that facility because there is no light in the place, there is no staff that will even receive them because we are only doing half days work, which is only the daytime. In the night, there are no staff there to mount the facility for us. So in the night, and you know that a problem used to happen to people in the night. So when this thing happen, there is nowhere, people cannot go there. No light, no staff, and even there is staff quarters there, but there is no staff to stay there.
Most worrisome is the state of the healthcare centers built and equipped by Algon in some communities, even in Gwagwalada Area Council of Nigeria's Federal Capital Territory, Abuja.
They feel bad now for not opening this place. All of them, they feel bad. They are not happy. So they just build this hospital, big, we think they are going to do something. They just keep the place, no use. Many people have been telling me, but I don't have anything. I say, okay, when they are ready, they will open. That is what I do tell them.
Personally, we have a councillor here. We talk to him. And he now carry the matter to the area council. First of all, there are some people from Gariki. Last time they came here, we learned our complaint to them. So that is how we go far. And since then, we don't have anything. And we're not here for the area council, and we're not here for those people from Gariki.
The management of Mathan Nigeria Limited says it is disturbed to see the comprehensive healthcare centers which it had the contractual obligations in conjunction with Algon to construct and equip in the 774 local councils left to rot.
You know, there is no way a hospital can function effectively without water. There is no water, there is no hospital. If you don't have water in any hospital, forget that hospital. You are breeding germs, bacteria, diseases, and all whatnot. So there is need for water, regular water supply. And that is why we have also factored into this project boreholes. There will be boreholes that will supply 24-hour water to the various health centers. And not only that, you cannot function, such hospitals cannot function effectively without light, because sometimes there will be emergencies that will require carrying out minor surgeries. Light will be needed. Some tests, laboratory tests, will require light. Some other form of healthcare delivery services will require light, electricity. So we have also factored in a generator that can serve the entire hospital. And interestingly, the hospital has doctors' quarters there within the same premises. There is doctors' quarters. What that means that in the event of any emergency, the doctor is within the hospital complex, the healthcare center complex, and can always be asked to come and handle such emergencies, which gives it an advantage. It gives it a very special advantage. And if this is achieved completely, you can be surprised at the turnaround effect it will have on the people of that community.
It will be a waste of resources if we just erect these structures and we don't have them properly equipped and with the appropriate manpower manning this. It will be equivalent to drilling a borehole near a river.
Mathan Nigeria Limited prides itself as a leading name in diverse sectors of the national economy, namely telecommunication, oil and gas, manufacturing, energy, safety, health, and many others. The company gives high priority to the delivery of the finest and most durable medical equipment to complement efforts aimed at achieving healthcare delivery to the generality of the Nigerian population.
Beyond the provision of healthcare delivery services to the rural dwellers, there is another aspect of this project that is very important. We know before now, during the colonial era, we had a lot of dispensary units scattered all over the country. But I bet you, if you visit these dispensary outfits, they have dilapidated. So what this present government actually needs to do is to, put some touches on them and ensure that the structures are put in good order and make such dispensaries functional. And these primary health care centers with the doctors and the healthcare personnel in them can now be given the responsibility of supervising them, providing them with some basic trainings, some basic information they need to handle some other minor cases within such area.
Having these structures erected and having them well equipped will not only reduce the disease burden on the communities, it will also create employment opportunities because we have a lot of graduates who can work in these areas, in these hospitals or in these clinics as community health extension workers or even community health officers or even medical officers who are actually medical graduates from our various medical colleges. It will also help in bringing government closer to the people and also improving the confidence of the people in the government.
In the area of health equipment supply chain, Mathan Nigeria Limited has developed a perfect understanding of the operation and economics of the processes, including functions such as transportation, distribution, warehousing, and information processing. Instructively, while using a governance framework will play a significant role in overcoming some of the challenges identified in the running of the comprehensive rural healthcare centers, it is important to recognize that most successful public projects have been driven by private-public partnerships.
It's not enough to build 10,000 healthcare centers, additional healthcare centers across the country, whereby maybe each ward will get one. Have we looked at the functionality of such healthcare centers? Can they survive over time? Or we build the houses, the hospitals, the healthcare centers, and leave them, and they rot away, like most government projects. I think I would advise the government to reconsider their stand. It's not, I'm not saying that they should not invest on health, but investment on health should be properly channeled.
Mathan Nigeria Limited has carved a niche for itself in the supply of health and medical equipment to health institutions all over Nigeria. With an array of seasoned health professionals in its payroll, managing comprehensive healthcare facilities is one Mathan Nigeria Limited says it is ready, willing, and capable of doing, especially now that the Buhari administration is embarking on provision of 84 rural healthcare centers across the country. It is only when there is a genuine synergy among key players in the health sector and a deliberate and purposeful effort to sustain every project of government in the sector can the people truly benefit from democratic dividends.